presenting more of a general audience, and a lot of folks who do wonder what their options look like when it comes to postpartum birth control.
Great.
All right. Well, how about to launch this off, Pandia Health being about birth control, let's talk about what are someone's options right after they give birth. When should they start thinking about birth control, and what can they do and not do in terms of birth control because of blood clots, etc. Dr. Culver?
Yes. Oh, that is a fantastic question. So first of all, it really comes down to how is your health during pregnancy, and what is your health before pregnancy, and what are some of the if there are any chronic medical conditions that you have to be aware of. So more and more women are becoming
your baby that you're about to make. And then I just say from the practical side, I was trying to time my kids 2 years apart and having them 3 years apart. So the second one popped out at 3 years. So somewhere around, that equation, 36 minus 9 is 27. So when your other one is 2 years plus a couple months, do it.
yes.
And I liked having the 3 years apart because the older one was 3 and was out of diapers. So what you don't think about is if you have them too close together, you're going to have to carry a diaper bag with 2 different size diapers. So it's just like a practice. Or a postpartum IUD or a postpartum implant. At the very least, don't assume that you can't get pregnant. Always use condoms. I always say, just as a feminist, because I hate to leak sperm. That's Dr. Yen.
And I think that's so good to bring up, Dr. Yen, because when we've had a similar conversation to this one on Twitter Spaces, and something that some folks might not realize is that there's a lot of confusion in that sort of earlier postpartum period about using breastfeeding as a method of birth control. So I just wanted to bring this up because I know it was super interesting to me as a non-physician to learn that LAM, or lactational amenorrhea method, this is something that genuinely can function as birth control, but it's only if you're exclusively breastfeeding, right?
Yes, yeah. Well, the reality is about 40% of people will have sex before 6 weeks. So it is just really imperative to talk about the likelihood that if you're not nursing, that you can ovulate theoretically, 2 weeks after delivery. It has been documented, 25 days, and usually it can be up to, 40 days where one ovulates, like just on average. But the reality is that women are feeling good enough, or luckily there's good feelings that there's, intimacy afterwards, but there runs a risk. So if for women that are lactating, I looked it up again, and they say it's unlikely that you're going to get pregnant if you haven't had your menses in that first 6 months. But again, that doesn't, it's not 100%, of course. Also, you need to be nursing. There can't be intervals that are longer than 4 hours. And realistically, we're quite busy, and we're working and pumping. And we all know that when we're detained or we're distracted with something else, that clock will move. And it's like, oh my goodness, it's 5 hours, and so it's really hard in the modern day to be like that. Before, women used to wear the baby a lot more, right? I mean, we are going back to that, really nurturing position. And I even brought my baby to work, and had my baby in a baby born when I was doing my practice. But it's the amenorrhea comes from at-lib nursing, meaning the child is it's on demand always and always available. But again, that's not our life, our modern life. So yes, you can get pregnant even if you're exclusively nursing. And that is why it's important, again, before delivery, to talk about the options and what is a shared decision between you and your provider and your doctor or nurse midwife.
And then, postpartum, you also just want some time to heal down there. And so just, some people would recommend don't have any sexual relations for, I believe, 4 to 6 weeks, just to let it all, heal up down there. You need to rip open things, or just, it's so chaotic after that baby. Every time I see someone is pregnant and then they give birth, I'm like, welcome to the dark side. Every few hours breastfeeding. And if it's your first baby, it's all sorts of chaos. If it's your 5th baby, there's 4 other children running around the house, chaos, right? So it's hard, and, don't push yourself to have sex if you're not in the mood. As I always say, you can do other things, mutual masturbation, oral sex, and then a plug for condoms. I think condomdepot.com should pay me, but I love condomdepot.com simply because, and I don't get paid, because they have the person with the penis rated this a B+, the person with a uterus rated it an A-. And so having a couple of really good condoms around in case you do go that route, to prevent unplanned pregnancy.
Yeah, most definitely. Thank you, Dr. Yen, for mentioning that. Yeah, we really try to be, well, we are in the woman's corner here. Make sure that you're not coerced into thinking you have to do something, but the reality is that, some people are, and there have been studies that show, and we want people to rest. Obviously, there is a lot of healing in terms of like internal perineal healing. And so, yes, thank you.
Yeah. And that's a great thing to bring up, because one of the chief complaints for our pelvic training and recovery, which is like a virtual version of pelvic floor PT, one of the chief complaints, along with incontinence, along with feelings of heaviness in the vagina, is painful sex. Mm-hmm. And so a lot of folks, if they're trying to get back into intimacy with their partner early, may experience pain because of pelvic floor prolapse, because of other pelvic disorders, because of perineal tears, maybe even recovering from an episiotomy. It's really frustrating, and I think it's very easy to blame yourself. But the truth is, this is incredibly common. 83% of postpartum people experience some version of a pelvic floor disorder. And so painful sex does come along with that. But it's important to know that it's not hopeless, and you can do work on your pelvic floor, right? It's a series of muscles, this hammock-shaped set of muscles that sits within your pelvic bowl, holds all your pelvic organs together, and it can be strengthened. But really what's important is first diagnosing and recognizing to what degree you have that prolapse. And that can be so hard because when you only have 10 to 15 minutes one time with the physician, 6 weeks after giving birth, there's so much to address, and you might not even realize what's been going on. So we always encourage our patients, if you are having painful sex, don't feel ashamed. It's super common. Talk to your partner about it, and then let them know that there are solutions and that you can actually work on it. And by the way, not only would you be shoring up your pelvic floor against that pain, you might also be saving yourself with some incontinence issues. So I think that's just something we always like to talk about when it comes to postpartum, around the same time that you're considering your birth control. And one question I wanted to bring up for both of you was, we have heard a couple times from patients, should I go right back to the exact same birth control I used before I got pregnant? Is that common practice? And why do you see some folks change birth control method after giving birth?
So I'll do my jump, and then Dr. Culver will come in for the close. So, we don't recommend any estrogen-containing birth control if you're breastfeeding, because that can decrease the volume of the breast milk that's coming out. So a lot of people are on estrogen-containing methods. However, if you are on the copper IUD, the Mirena IUD, the implant, the shot, or the progesterone-only pill, or a specific drug called Slind, those are all progesterone only. So those are okay while breastfeeding. But that was the thing was, I liked having no periods during pregnancy and on my birth control pills. But then when you have a baby, the periods do go away if you're exclusively breastfeeding, but then they come back. And then you're like, well, period or kid breastfeeding. And I chose kid breastfeeding because it's better for the kid, but sucks for me to bleed, man. But you could do the IUD or the implants, and that would help with that situation. And then I think just in general for blood clottiness, we don't, I think, recommend anything until 6 weeks. Is that right, Dr. Culver?
Yes, I do 6 weeks. If you're not nursing, 6 weeks, you should wait to restart a combined birth control pill that has both estrogen and progestin. And if you've had a C-section, and again, kind of sometimes like the weight issue, and are you mobile? Really, are you being really truthful with your activity? Generally, you would have to wait 8 weeks, but maybe it's safer to wait longer, and maybe it's better in those circumstances to really talk to your patient and really talk about the IUD and the progestin containing IUD that gives you less bleeding as well for the interval time. In terms of which birth control, you also want to look at the age, right? So if you are over the age of 30 or 35, depending on, again, weight, sometimes you have to be on maybe a higher dose of estrogen containing birth control for effectivity reasons. But when you're in your 30s, you can drop down to a 20 microgram tablet. So that might be lower than what you had been previously on in the 20s. So that's when you're not.
Great. And that's so important to bring up.
It depends on breastfeeding or not breastfeeding. And then an absolute start at 6 weeks, just blood clotting wise for hormones. A copper IUD you could start earlier, but my caveat on copper IUD, because I answer all these questions on Reddit and Quora, more blood, more cramps, but each woman is different. If you're the woman who gets your period and you're like, oh, is that my period? Then yes, you do copper IUD. But if you're the one that bleeds like stink, maybe not so much. And if you're the one that feels every cramp, which I do, maybe not so much. So, but that one would not have any hormones.
Yeah, same here, Dr. Yen. It was when it came time to make my choice about an IUD, it was straight to Mirena. I knew that I couldn't handle the copper IUD. So just for anecdote's sake, I know a lot of American women get freaked out by an IUD, but it's been the great choice for me. It totally removed my periods, and I used to get debilitating cramps. I remember in high school, I had to take time off. I fainted in the hallway once. You know, Mirena has saved me from all of that. So I am incredibly grateful to it. And I always have to tell my friends, like, the implantation does not feel good, but it's one time. And then I have it for, now I think it's been FDA approved for 7 years of use, which is amazing. So
my 3 tips, you can Google IUD, and then in there's Dr. Yen's tips on getting an IUD. 1, get it at the end of your period. And so the os is already open and you just go through. There may be a greater likelihood of it coming out, but the os is open, but you can get it anytime you want. Take 600 milligrams of ibuprofen, assuming you don't have any kidney disorders or allergies ahead of time. And that's equivalent to a milligram, I think, of morphine. So that's also good. And then ask for a cervical block. So we used to be like, we don't know if you need a block or not. And as a woman, I was like, oh yeah, you block. Err on the side of no pain, But the most recent paper, and it's no longer even recent, I think it's 2020, said that the standard of care is they should do a cervical block, which is they do an injection to numb up your cervix before they put it in. So those are my tips, is at the end of your period, not when heavy flow is coming out, and with some ibuprofen and a cervical block.
That's wonderful. And I'd also quote the nurse practitioner who I worked with to get my last IUD actually recommended masturbation before attending my appointment. And I thought that was such a great tip for the obvious reasons that after successfully masturbating, you're going to relax your pelvic floor and all of your pelvic muscles. And so the spasming that you might experience during the IUD implantation could theoretically be less. Tried it.
Great tip.
Found it helpful.
Wow. Okay. That's great.
Very cool.
Awesome.
Well, I want to, acknowledge everybody that's joined us. Thank you so much. If anybody has any questions, hit us up in the comments. My other postpartum tip is, if you can afford it, get a night nurse or a doula postpartum. Ours cost the equivalent of a car, but it was totally worth it. She was amazing, was able to put our baby on a schedule such that it always ate, slept, then peed in that order. And so when you cried, you knew what it was because it was in that order. She'd wake up because she peed, and then, change the diaper, bring her over to feed her. And then, it was like that cycle. And she was also amazing at having my daughters sleep through the night. And you hear stories of other people whose kids don't sleep through the night, and you're like, oh, I'm so sad for you. And then you hear stories of people whose kids sleep, 6 hours, and you're like, oh, they skipped a feed. That's awesome. As long as the kid is, the right weight and everything.
Yeah, I would ditto that. I would say also prior is to make sure you're set up with a lactation consultant, because even if your first child, everything went great, every child is different, has a different sucking mechanism. Maybe I had one daughter who had, she needed OT for the suck, sure enough, it required multiple visits. And if I hadn't had that as a resource ahead of time, I know that it's difficult sometimes to get in. And, you sometimes are having an issue and you're discharged, and maybe it's on the weekend, and then you're like, oh my goodness, who do I call? And I know that there are virtual lactation consultants, but they also are booked as well. It's difficult. So you want to maybe have, even a pre-delivery lactation meeting. So therefore, when problems do arise right away, and then you also it's also beneficial to have it regardless. So a 2-week check-in, make sure the suck is correct, it's established, and so forth.
Yeah, Dr. Culver, I love that point. We actually encourage all of our patients to do a prenatal virtual lactation session. And I can't tell you how many times folks have said, they've actually emailed us and maybe asked, like, do I need this? Is this important? I know I'm going to get a session with a lactation provider when I'm in the hospital. Think about it this way. Would you rather study for the test before the test happens, or be 12 hours after one of the greatest physical events in your life, and then have somebody trying to put new information into your brain when you're exhausted and just trying to rest? I would always rather study for the test before it happens. And so doing a prenatal session with one of our lactation support providers is a really easy way to prepare yourself. You have this equipment on your body that you may not have used in that particular way. They can help you to understand not just how to use your own breasts and attempt your own lactation, but also to think about a pump, to think about storage bags. There are so many accessories and additional elements to breastfeeding today. And even if breastfeeding is not your only option, they can help you think about how to supplement with formula, or how to know when, to call it quits. So we have those virtual lactation sessions available at Ruth Health. They are 30-minute sessions. So something that you can easily do from the comfort of your own home with one of our providers, and you can book as soon as next day. And I think even if it's not with us, getting in touch with somebody locally is excellent prenatally. And then postpartum, you can also talk to them about your birth control and get a sense for what they would recommend to keep your supply, untainted. And like Dr. Yen said, that's just keeping away from that estrogen.
My other pitch out there is La Leche League. So it's a, women who breastfeed, or those with breastfeed, supporting those who want to breastfeed. And before COVID, they would gather and everybody would just breastfeed. And so I say, if you're thinking about breastfeeding, go watch someone breastfeed. And if it's your friend, be like, can I watch carefully? Because Dr. Yen said, stare at the mouth boob connection and how that goes. And back to my pediatrician days, doing breastfeeding right after the mom gives birth. Quick tips: make sure the mouth is open as wide as possible. Don't do the fake, the kid will go like this. No, you gotta go for the big open and then shove as much boob in there as possible, because if it's this, it's going to be chomping on your boob, versus this, which is squeezing it correctly. And then the other tip is the kid is on your boob, like suction. And so you need to put your finger in there and pop the suction. Do not pull the baby off, because then your boob will be, you want to pop the baby off, pop that suction, or else you're going to have macerated boob. And then you can use milk, or you can use, I forget, it's been a while. What is the lanolin, right?
Yep.
Lanolin as the application. And then another plug for a company that you pay me, Breast Friend. There's the Boppy, but the Boppy's too soft. It's good for later when the kid has its own head controller, just better, but that first new baby, I would suggest the Breast Friend, because it's a stiffer breastfeeding pillow made by lactation specialists, a physician and a nurse, with little headrests to prop your kid up, and I just wore it around my waist and walked around the house while breastfeeding with the kid on a platform. So go to La Leche League, stare at your friends who breastfeed, don't be afraid to ask. And then I love the breastfeeding covers. I think those are cool and great and high technology, with a wire so you can see your kid and you can breastfeed everywhere and anywhere.
Yeah, and shout out to Dr. Culver for mentioning her baby's mouth seal and anatomy. I love that point, because one quick thing, I know we have to wrap up soon, but tongue ties. A lot of new parents who are breastfeeding or chest feeding don't know that a tongue tie exists. And we actually have one amazing lactation consultant, shout out to Ray Paris, who informed me that there are actually some physicians who don't believe that those exist. But here are two physicians who get it. And there's even pediatric dentists who help treat a tongue tie So sometimes issues with breastfeeding or chest feeding are not actually the breastfeeding parent's fault. It's more of an issue with baby's oral anatomy that makes it very hard for them to get a latch. So sometimes you may feel like it's your fault and it's really not. And it's great to talk to a pediatrician or a pediatric dentist about that.
Definitely. I also had one more comment, and that's, you know, the American College of OBGYN has changed its like strategy on addressing postpartum care, and they're saying it's a fourth it's the fourth phase, right? And that you really should have a touch point somewhere within the first 2 weeks. And even the World Health Organization says the first 2 or 3 days, because you're looking for issues that need immediate addressing, right? And then 2 weeks, ACOG is suggesting a touch point. It could be something where you phone call or have virtual, but that you have to have a touch point, and that you need definitely to see that, or have again an assessment on how the baby's feeding and what are you going to do for contraception or checking in for chronic diseases and follow-up by 6 weeks. And then really to have all the comprehension of a very detailed wellness visit, where there's appropriate trades to other physicians for follow-up and so forth by 12 weeks. So none of this drawing out, because a lot of women, miss postpartum visits, and that's really not good, because it's a transition into well care, and again, for longevity for both child and mother.
Don't miss
that point.
Go to your follow-ups.
Yeah.
And Ruth Health is here virtually, right? Do you guys also do in person?
Absolutely. Just virtual for now. Yeah. So check us out at ruthhealth.com. And I want to encourage everybody who's seeking their postpartum birth control options to check out Pandia. Super helpful, convenient delivery, and you get little treats in the package, and it's just a delightful experience. So thank you guys so much for having me on here, and really hope you have a great rest of your week.
Yes.
Thank you.
Dr. Culver as well. Thank you, Allison. Thank you, Ruth Health. You are definitely a trusted partner that we are happy to refer anybody who's stopping their birth control and going on to have a baby. We want you to have the best possible experience.
Same here.
Thank you.
Thanks, Dr. Culver. Thanks,
Sure.
Dr. Yan.
Thank you.
Thanks
Bye-bye.
everyone who joined.
Thank you.
Bye-bye.
Bye.
Bye.